call, and then we'll get started.
Hey, Andrea, it's Serena.
Hi, Serena.
Hi, I'm just getting into my office.
Okay, great. I think we're waiting for, we've got 6 people so far, so maybe we can give a couple more minutes.
Okay.
And then it's all turned to you to launch.
Oh, I'm good, thank you.
Okay.
Hi, this is Nicole. Am I the only one on or no?
We've got about 7 people on right now. This is
Oh,
Andrea.
okay.
And
Hi, Andrea.
Serena just joined. Hi. Serena, what do you think? You want to go ahead and get started or give a couple more minutes?
Let's give 1 more minute, probably, so
Okay.
I can call in.
Serena, Hetty Chang says hi.
Hi, welcome.
Oh, thank you.
I saw Lori just joined. We've got a few people on.
Okay, so Andrea, I think we can get started. How many people do we have?
We've got 8 people.
Okay. So, hi everyone. This is Serena. I'm sorry, I'm not logged on yet, so I don't know who's on. So I'm going to have to ask people to self-nominate to give their update and check-in, which I always find a little bit annoying because it's hard to know when to talk. But here's my check-in question. So 2 things. First is, what is something fun that you're looking forward to doing this holiday season? And the second is, what question do you have for your colleagues, something that you would like to know about other state associations or school-based health centers in that state? So at the association level, it could be like you really want to know how people work with their boards, or how they fundraise, or how they handle their communications. Or at the school-based health center level, it could be something about, how school-based health centers function in other states. And Andrea, can you take notes?
Yeah, we're recording this, so we should be good, and we'll definitely drop some keynotes too.
Okay, so you don't need to take notes on the vacation part. And because I always figure people need a moment to think, since I've thought of the question ahead of time, I will go first to give you all a chance to think about what your question is. Hopefully everybody knows something they're excited about on their vacation. So my vacation share is that my in-laws are coming, and I always find that really stressful. And so this year we actually decided to rent a house that all of the in-laws and us could go to, and I'm really excited about that because I'm feeling like then I don't have to be the host and be stressed out by the usual things I get stressed out by when all the in-laws are in town. So I'm hoping it'll work out, but I'm very proud of myself for just making this choice. And my question about school-based health centers is I am wondering across all of the states, how many school-based health centers, or how common it is that school-based health centers are really working outside of clinic walls, doing prevention, education, screenings. Is that common in other states, or is it more common that school-based health centers are doing sort of traditional clinical care but on a school campus? So that is my question. And I'm going to just ask for volunteers to go next.
Serena, this is Jessie.
Hey, Jessie.
Hi, and I'm at the Capitol, so I'm going to have to put myself on mute because then you'll all hear everything I'm hearing. So I'm going to do that and go later on if that's okay. I just wanted to let you know I was here.
Okay.
Thank you.
Hi, Serena. This is Lori Huffman from Oregon.
Hey, Lori.
Hey. And a fun thing I'm looking forward to over the holidays is a good friend of mine is gathering families for a big dinner, including kids home from college on Christmas Eve. So I'm really looking forward to that because I haven't seen some of the college-age kids for a while in particular. So that should be fun. And one of the questions that I have is I'm wondering about what other affiliates have experienced with effective strategies for cultivating individual donors. That's my question.
Thank you. I can tell you that we earned $50 on Giving Tuesday.
Good to know.
Yeah. All right, who would like to go next?
Hi, this is Nicole from Maryland.
Hi, Nicole.
I can go next. I think for the holidays, I'm actually just looking forward to spending the holidays with my kids and my husband. My daughter's 2 now, so she actually understands it's a holiday, so that'll be fun. And we have family coming into town and kind of spending time with them. So a question that I have, we are embarking on creating a learning collaborative, a statewide learning collaborative after the first of the year, and so how states have approached bringing together staff and clinicians and educators from different districts or different schools even to practice new strategies and learn from one another. I'd be interested to kind of know more about that.
Great. Thanks, Nicole. Next. All right. I'm now on and I can see, so I'm going to start calling on people.
This is Kristen Nyan. I'm here from Illinois for Heidi. She's out sick today. And so I'm the new coordinator. I started about a month ago. So this is my second call. And so something fun I'm looking forward to this holiday season is actually going ice skating with my family because that's something I've always loved. So I'm looking forward to that. And then a question I'd like to know from others is we in Illinois still don't have a state budget, and I think on the last call we mentioned we've been setting up site visits with legislators, so just if other states have had experience advocating for funding for their school health centers at a state level, and I guess what they thought was most effective when trying to sell the message and the value of the school health centers.
Great, thank you. Is it Kristen or Christine?
Kristen.
Kristen, okay. All right, so you're showing up as Heidi.
Yes.
Okay. Okay, who else?
This is Marilyn.
Hi, Marilyn.
Do you want me to Hey.
Go for it.
Okay, so Marilyn from Ohio. And on hopefully the week of Christmas, our 3rd grandchild is going to be born in Virginia. So I'm looking forward to spending the holidays with my new grandchild. So, and I think the question that I have is about the, as far as the, again, kind of related to the state funding, that's something we've tried to do, and we're one of the states that's never received any significant state funding. And so kind of maybe some ideas on processes in the beginning that worked for getting that state funding that we can't seem to fund.
Great. Thank you, Marilyn. I'm very envious of your grandchild. Let's see. I see Ruth.
Oh, yep, I'm here. Came in a little late. How is everybody?
We're all good. How are you?
Good, good. So what questions are we answering?
Something you're looking forward to for the holidays, and a question that you have for others about how school-based health centers operate or how state associations operate, anything that you would like to learn from everybody else. We're not going to answer them now, just asking the question.
Okay. All right, cool. I'm looking forward to, well, actually, I was late coming on because I just clicked my last send button to finish my holiday shopping. I am done. I'm so happy. It's a done deal. So I'm just looking forward to just, you know, relaxing and enjoying my grandchildren. In Georgia, we're trying to figure out a couple of things. We're trying to develop a budget for our state association and what types of things should be included in that budget. Right now, we have no budget, and anything that we're doing is kind of being underwritten by Emory. But we're going to be moving from that structure probably in about another year or so, and be a standalone association. So we're trying to figure out budgets and what should be included. And also, we started working with our state legislators here in Georgia to advocate for line item funding for school-based health centers in Georgia, and just wanted to learn what that funding looks like in other states that have it. I think there are 18 states at this point that are receiving funding from their state budget, and you know what they're using those dollars for.
Great, thank you. Okay, who else has not gone? Marcel, are you on?
I am. Sorry, I was muted. I'm never sure how fully I get to participate in these calls since I'm not a state leader.
All right, just tell everyone who you are.
I'm the Communications Director for California School-Based Health Alliance. And I've got lots of questions about what other states are doing. But I encourage you, if you want to talk about communications and how you're communicating about your school-based health centers, to join me on the call directly after this one, if you want to. I'm really curious about how you're communicating to educators about your work and about the value of your school-based health centers.
Cool. All right. Marcel's using the opportunity to put in a plug for his work group. All right. What's your holiday thing, Marcel?
Oh, I'm going to Vancouver. My husband's family lives up there, so that's what I'm going to be doing. So no daylight, but lots of good food and other stuff.
Okay. Thank you.
Nicole?
Is Nicole?
Oh.
Yeah. Who's that?
Oh, I'm sorry. It was Jesse, and I'm outside where I can.
Okay, Jesse.
I'm sorry. I have a question.
Yeah.
Well, my holiday thing is that both of my grown sons and the one who has a family, they're all flying in, so that's going to be awesome. Nice. My 2-year-old granddaughter, have a ball. Can't wait for that. But my question is, we have an issue with with billing in our school-based health centers in Connecticut, where if the school-based health center is not sponsored by an FQHC, they cannot bill for a medical visit and a behavioral health visit on the same day. Only the FQHCs can do that, and that might be because of the way they're enrolled in Connecticut specific. Understanding is that CMS made a ruling saying that, especially with the goal of integrated care, that you can bill for a medical visit and a behavioral health visit on the same day and be paid. And I'm wondering that, that if other states are having success or any issues with that. That's my question.
Okay, great. Thank you. Then that sounds like it might be something that the new Serena Reckling can take up when she comes on, he or she.
Yes. Yes.
So, okay, let's keep going. I want to resist the temptation to get into discussion about any of these questions. I see John's name. Are you there, John? Okay, I don't hear John, but I see his name. And I also see Nicole Fairchild.
Yes, I'm here. I am looking forward to going home to Ohio for Christmas. That's my looking forward to. And I guess my question, although I love Jesse's question, would be just to hear somebody's best tip for activating their base. Like, what's the most bang for your buck in terms of getting your word out and getting people interested in what you have to say?
Okay, and you also have Jesse's issue?
I know of it. I don't know that we have any success with it. I think it's a great question.
Okay. All right, did I miss anyone who is able to speak?
Yeah, this is John. I just got on.
Yay.
I apologize.
Hi, John.
Good afternoon.
Good afternoon. Morning.
Well, here it's afternoon.
Okay, did you hear the questions?
No, please repeat.
All right, the question is something you're looking forward to over the holidays, and one question you have for the rest of the states about something either at the state association level or at the school-based health center level. Something you're curious about how it's working in other states.
I guess my question of curiosity would be, right now we're looking at all the grant opportunities that are either coming out or are out currently, and I'm interested in what everybody else is looking at, and what I'm doing over the holidays. I plan on sitting in front of the fire. That's about it.
Okay, thank you. How about School-Based Health Alliance folks?
Hi.
Hey, Andrew, I know you're on.
John
there?
Here. I'm here.
Hi, John.
Can you hear me, sir? Hi,
yep.
Everybody. Very quickly, I am looking forward to my husband and I go to Florida to visit my family, my brothers and their wives and kids, and my mom and dad, and that's always great fun, and it's nice and warm. And my question, as most of you know, is I'm always distracted by the next shiny object that's in front of my view, and the one right now is really fascinated with the idea of restorative justice and healing, and wondering if that feels like a framework for school-based health centers to think about their work. And I'll pass on to Suzanne.
Great, thank you. I could talk about that for a long time. We are drowning in restorative justice. Okay, Andrea?
Well, John passed it to me. Hi, everyone.
Oh. I'm sorry, I didn't hear your name. I didn't hear who it is.
This is Suzanne Mackey.
Oh, Suzanne. Hey, Suzanne.
Hi. I am looking forward to / slightly dreading having all my family and my in-laws in for Christmas, and I'm hosting, which should be interesting. So, but it'll be nice, just stressful. And then I guess if anyone has any advice, send it my way. And then I guess, well, I'm going to talk about it a little bit later today, but I do have a little bit of an update. I want to chat a little bit about the status of the place of service code effort and just kind of see from you all if any progress has been made with your state Medicaid office. So I'm going to talk a little bit about that very shortly. And I'm going to pass it on to Larry.
Thanks, Suzanne. Larry Bastian here, and we're traveling to my brother-in-law's in Connecticut, and all our boys will be together. They're all adults, young adults, so that'll be sweet. And a question I have, well, I would just kind of echo John's ACEs, restorative justice. These are all things that seem to be in the air. And how do we, from my perspective, how do we bring them down to the ground so that they strengthen the case we can make for the value and the work of school-based health centers?
Hi there, my name is Kara Ann McRae, and I'm new to the School-Based Health Alliance. I'm in the research and evaluation section, and I am a new to the East Coast and defending my dissertation at the University of Colorado, so I am looking forward to not flying anywhere for 4 days over Christmas and deserting. That's what I will be doing. And as far as what I'm interested in is, now that we have a little bit more bandwidth here nationally for the research and evaluation, is how to best support the states in their evaluation efforts and be of service to all of y'all with the projects that you have. So as introductions are made and as Haley helps me to reach out and meet everybody, I will be learning more about your states and hopefully more of what I can do to be of service to you.
Great, thank you, Kara. Okay.
Andrea, you're up.
Okay. So I don't have any huge plans over the holiday, but I am looking forward to this coming weekend. I'm taking a long weekend, and it's the first trip that my husband and I are going on alone since children were born, so I'm very excited for that. And then for my question, I too, like Larry and John said, I'm thinking about the latest shiny object, and a lot of conversations about social determinants of health are carrying throughout my different projects, and would love to find out what different tools our school-based health centers are using to get to figure out the social determinants of health of their students.
Great, thank
you. And this is Jordana at the School-Based Health Alliance. And following up on Andrea's question, I'm also interested in determining what school-based health centers are using to determine social determinants of health and how this work is being done in clinics throughout your state. And I'm excited. I'm going on a cruise through the Panama Canal.
Oh, wow. That's big. Into the Panama Canal.
Yeah. Yeah. Wow, that's exciting.
Okay, is that everyone on your end?
I think so.
Okay, great. Well, I'm really excited that there's so many of you on the call. I think that's awesome, and it's nice to hear new voices, and there's so many of you at the national office now that it's hard to keep you all straight. So it's nice to have this touch point, just to hear names and associate people with roles and stuff. Let's see. I do think there's some things that cluster together here, and I think, Andrea, it would be nice if you and I could just touch base either by email or by phone about maybe putting some of these things on the agenda for next time.
Yeah, that's
great. If we have time this time, I think there's some things we could talk about on this call, but let's just wait and see how we do time-wise. So the next thing I wanted to do is, we're going to do the committee updates, but I first wanted to make sure that everybody had signed up for a committee, and Andrea sent me the list, and it actually looks great, and I think most people on this call, I haven't done a complete comparison, but it looks like a lot of people have signed up. So I'm just going to tell you who's on the committees. So for communications, Marcel is chairing that, and we have Nancy Rodriguez from New Mexico, Allison Kilcoyne from Massachusetts, Kelly Caseman from West Virginia, Nicole Johnson from Maryland, and Kyle from the National School-Based Health Alliance. So that's a good chunk of people on communications. On standards and measures, we have Sarah Murphy from New York, Heidi from Illinois, Marilyn from Ohio, myself, and Sue from Louisiana. And on telehealth, which is chaired by Ruth, we have John Bindus and Nicole Fairchild from Arkansas. So if you haven't already signed up, please do. And if you have any questions about what these groups are doing or what it means to sign up, we probably can't answer them because we don't really know exactly yet. But as you recall, we have set some goals around trying to do at least one small concrete thing in each of these groups by June. And I think in some cases it's gelling a little more clearly, in other cases it's not. But feel free to reach out to either me or Andrea or the chair of the group if you have questions. And I think it's really great if there is consistent participation among the members of the group, because it's really hard to move forward if it's constantly different people. At the same time, if you signed up for something and you feel like, oh, this just isn't what I thought and I'm not feeling engaged, then I don't think we have any prohibition against switching to a group that you feel more engaged in. So does anyone have any questions about that? Okay, then let's go to our next agenda item, which is committee updates. And why don't we start with communications, since Marcel is on.
Sorry, just had to unmute myself. Hello, everybody. We are kind of moving forward with a fact sheet. We have a draft fact sheet, and I would like to put it in front of all of you at an upcoming call and get some of your feedback and kind of have a little bit of a discussion with everybody, even people outside of this communications group, to find out some things that have been working for you or some things that you want more of or what would be useful for you. So we're trying to put together some of these messages, some stats, some facts, so that we could all have something that we could share, that we could customize and personalize. And I do also want to bring Kyle in from School-Based Health Alliance more deeply coming up to do a little bit of kind of branding around it, or add some graphics, because one of the feedback that we've received is that state folks who are going out and talking to people, talking to educators or talking to education groups would really appreciate something that is not all words, that has something that catches the eye. And so we're thinking that we're thinking of something that kind of has a really captivating image, or has more graphics, and is able to catch the eye, and then has some of those key messages and some key stats around some of the issues that we're all working on with school-based health, to get that message out and leave as a leave behind or something like that. So that is where we are with it. We've got some stats, we've got some base messages, and I want to bring it to you all to get some of your perspective and find out what else could make it better, make it stronger, and make it something that you all would really want to use.
Great, thank you. And I want to add one more. This doesn't feel like it's going to be efficient. Okay, let me not do that now. Let's come back to that. Okay, let's go on to telehealth. Ruth. Hey, Ruth, we can't hear you if you're talking.
I'm sorry, I was muted.
Okay.
I'm sorry.
There we go.
Okay.
Hi.
Okay, so not a lot to report. I did participate in a phone conference yesterday with Steve North and Amanda Martin, who actually did a pre-conference session on telehealth during our last convention. And there's going to be a spot at the Health Alliance website where the whole group can communicate. And for my committee members, I'm going to get that information to you guys, okay? But we talked a lot about what kind of things we'd like to come up with, and just how telehealth is being used now in the school-based setting, and any recommendations we have going forward. And hopefully we can gel that with our executive directors committee and come up with some type of position paper by June.
Okay, so the goal is to come up with a position paper or a statement about school-based telehealth?
The goal is, yeah, for actually our subcommittee, our telehealth subcommittee, to come up with something that we can present to the other state leaders to see, to get feedback on.
Okay. And can I just wanted to ask you, because I'm trying to figure out what would be relevant to share with you about what's happening here in California. Is it going to be at the very general level, like, do we believe in it or not, or is it going to be more specific at the practice level, like if you're going to do it, it should have this element and this element? Or is it more at the policy level, like this is what state policy needs to do to support telehealth?
Now, I don't think it's going to be like state policy, but I envision it being like this is how we see the best use of telehealth in the school-based health center setting.
Okay.
And we're also going to be talking about price tags that go along with this, equipment and presenters and receivers on the other end that are actually diagnosing these children. And so I don't know, it might come out to be kind of like a menu, if you will. This is what basic telehealth is about, and this is what you can do with it, and these are what you can do with other peripherals added to the machine, kind of thing.
And are you going to be getting into, or is this on your radar, the use of iPads and iPhones?
I've heard a little bit about it. Don't know enough to speak on it, though. But yeah.
Okay, because that is something that we're seeing quite a bit of here in different contexts. Okay. And we already had one very negative reaction from a school physician on the idea of students getting services from a doctor on an iPhone. So, does anyone else have any questions for Ruth on telehealth, or anyone else on the committee? Okay, then we're going to move on to standards and measures, but I don't know who's going to report.
This is Stephanie.
Anyone on the call?
Yep, this is Stephanie.
Stephanie.
Can you hear me?
Yeah.
Yeah, can you hear me?
Hi.
Hey, sorry I'm late joining. So Standard and Measures Committee, we had different folks again on the call. So I've started to think about this as like a progressive dinner, like we get a different course with each different group that we have. So it's kind of fun actually, because the suggestions and the recommendations are slightly different depending on who's on the call. So the other thing I've started doing is I'm taking sort of committee meeting minutes, so that whenever we do have the list of who's on our committee, if you miss a call but want the update, I'll send those out to whoever ends up being on that list.
That's brilliant.
So that's one thing that I wanted to share. So the suggestions that came out of the last call, we had Marilyn and Heidi and myself on the last call. And they suggested the idea of developing our capacity to tell our individual student story and our school-based health center story, in addition to telling this, our story through the aggregate data. And one of them suggested, I can't remember which ones, that we could work with the communications committee to accomplish this goal. So it was sort of connecting the idea that we would use data and information from our centers and from individual students more for like a marketing kind of approach or perspective, I guess. And again, sort of dovetailing with any work that communications might be doing. Another suggestion was that we create a national repository where state level or national level data reports can be generated. And then a third suggestion was that we spend some time clarifying how states access their state level data and what reports are currently generated from state program offices. And it was noted during that discussion that this might build on some of the work that I think Haley already did in preparation for some of the NQI COIN work. But I think there was sort of a general interest in just knowing, what data do states collect already and how is that used or summarized by the state program offices. And then the last thing that was mentioned on our call last time was just that it was noted that on the the folder for where you upload documents on the SBHA website is titled NQI instead of Standard and Measures Committee. So there was some question about whether or not that might create some confusion, and people that are supposed to be uploading documents related to any state or alliance reports that they generate annually might not know where to put those. So I think that was everything that we talked about last month.
That's really awesome, Stephanie. So are you the chair?
I am co-chair with Tammy.
Okay, great. All right. So actually, neither of you is on this list that Andrea sent over. So Andrea, can you just add them?
Yes. Okay, so I'll do. So Stephanie, we're co-chairing. Okay.
Yeah, Stephanie and Tammy. Okay, does anyone have any questions for Stephanie?
Stephanie, this is Sarah from New York. Can you hear me?
Yeah.
Okay, great. Would you send me the minutes from the last call? I'm sorry that I missed it. I missed the whole last state call because of a conflict, but I would love to hear what the others had said, because prior to that, you're right, there were 3 completely different people on the call.
Right, and the one and the one before that too. So so I actually have minutes from all 3 of the different committee meetings that we have had so far. And it didn't occur to me to start taking minutes until I think the second call, and so I don't have who attended the first call. Right, I don't have who attended the first call, but I have the second and the third, I think. So.
One thing I just wanted to ask the national in general is are you opposed to someone being on more than one committee?
You mean on these state affiliate committees?
Yes.
I'm going to answer that as the chair of our state affiliate group with a strong no, we are not opposed. Good. All participation is good. One is good, 2 is better.
The hard part is you guys have the calls at the same time is the only issue.
Yeah, that's the challenge.
Oh, right. That's a challenge. Yeah, that's a challenge. But I think we aren't going to change that for the moment because we've sort of settled on this and want to see if we can make it work.
Yeah.
Okay, because I would be interested in talking to my head and for the communications, and I think Stephanie has a great suggestion there that the last call came up with, is that you know, communications really is going to be the fallback for a lot of these groups in a way, but I would love to kind of toss my head in for both of them. Standards and measures is something that my leadership is interested in, and communications is a little more my area of expertise. So I think it would be great if I could kind of manage to dip my toe in both.
Well, there's call-in numbers for each of the groups, and so I don't think anyone is prohibited from popping in and out of different groups.
Great.
The only thing I would say is let's just be mindful of the value of kind of consistent participation, and I think that your idea of the notes is a great idea, Stephanie. So that would be great if other groups can do that too, but I don't want to make that a expectation necessarily, because I think we're just putting one foot in front of the other and moving each of these groups forward. And it sounds like there's some a little gelling around some of these issues, so that's great.
Mm-hmm.
So Andrea, we had talking about the shared resources that we might want to put up on the, I forgot what you call it, the state dashboard, but I think we should skip that because we're getting short on time and I want to get on to your piece. So let's just go ahead, and I want to turn it over to you guys now to do your national update and share.
Okay, great. Yes, we have Donna Behrens who's going to do a national update, and Haley and Kara Ann, I know you want to introduce Kara Ann, but I think we sort of got that opportunity at the start. Was there anything else you wanted to add about announcing her arrival before we pass it to Donna?
No, I think we're okay. Okay, since we're a little short on. Yeah.
Okay. All right. We'll pass the hearing to Donna.
All right, Donna, we're going to.
All right, can you hear me?
Yep.
Yes.
Okay. I did
send a slide deck. I'm not sure whether that's accessible. I don't see it on my screen.
Okay.
Can you open it on your screen, Donna? We can make you the presenter.
Yeah, you have control now, Donna. If you have.
Okay, please. I hate to be total ignoramus here, but how do I do that?
Okay. Did you see a message pop up for you that says "Show my screen"?
Nope. So just let me. If I understand correctly, do I use my PowerPoint on my computer? I apologize for being.
Yeah, no, that's
not a problem. And if you need me to advance the slides for you, I can also. It's up to you. We have it up for you.
In order to make this a little more efficient time-wise, Kara, why don't you go ahead and advance it? Let's not do this as a learning moment for me. So.
Okay.
For those of you who might not know, my name is Donna Behrens. I am working with the School-Based Health Alliance. I started last winter when the Alliance worked with the DentaQuest Foundation to apply for a grant around school-based oral health. And I was thrilled to be able to come on board at the Alliance to head up that new grant endeavor. It officially started in February. I think we kind of got things launched in about April. And we do have another staff person, Kate Schechter, who's been working with me, and also some of you may know her from her work with Voice to Health Group. And again, I apologize. I am not seeing PowerPoint on my screen, so I don't know.
Are you in GoTo, Donna? We have it up for you.
I'm in GoTo Training. But I don't see it. Okay, got it. It was a little slow. So the DentaQuest Foundation, for those of you who may not know, is a national foundation that has been giving grants across the United States. John, when did DentaQuest actually launch into national grant making? I think it was about 6 years ago.
I honestly don't know.
They originally started with their grant making in Florida and Massachusetts and have been slowly but surely spreading themselves across the United States. And about 3 years ago, they launched a strategic national initiative that is built around Oral Health 2020 goals that they came up with. And there were 7 overall goals, and those goals really are lifespan goals. They cover, they have goals around the 0 to 5 population straight through to the adult population, with a focus on getting Medicare and Medicaid expansion into adult oral health services. But pertinent to the work that we've been doing is that there is a goal that focuses on oral health incorporation in the primary education system. And the way the DentaQuest Foundation has organized its goals is that it not only has goals, but it's set up specific targets for advancing those goals, and within the targets, primary and secondary drivers. The primary target of the DentaQuest Foundation has been the 10 largest school districts in the United States. And for those of you, and Kira, I'm not sure, I think I have a list of the 10 largest school districts. This is probably, well, without it sitting in front of you, I will tell you the 10 largest school districts in the United States are the usual suspects, certainly New York, Los Angeles, Chicago. There is Nevada, the Las Vegas area. In Texas, it's the Houston Unified School District. There are 3 school districts in the state of Florida, Miami-Dade, Broward, and Hillsborough, which covers kind of both coasts, the Tampa area, and obviously Miami, and then up in the further. And I think the two surprises for me were to learn that the other two school districts were Hawaii. The whole state of Hawaii is one school district, and the territory of Puerto Rico, the whole island, is a school district. So we launched this initiative in February. Things really got rolling in April. This has been a real foundation development year. We have focused really on a couple of areas. First of all was to get a real feel for what's going on nationally around school-based oral health. So we engaged in a lot of research and a lot of outreach trying to figure out who are the big players in terms of national school-based oral health promotion and support, and where are their programs at the state level and at local city, jurisdiction, or school district level. We also began reaching out first with key informant interviews, and we just finished doing actual visits to meet with key stakeholders in all of the 10 school districts. Excuse me, 7. We actually visited 7 of the 10. We did phone interviews and specific key outreach to all 10 school districts. And we established a national advisory group who has been key in helping us think strategically about, as we gathered this information, how exactly we move into what the overall goal is, which is establishing a learning community around school-based oral health across all 10 of the largest school districts. We hope to include all 10 school districts, but our focus has been on the 7 what we consider the most ready school districts at this point in time. And I'm sorry, I feel like I'm kind of wandering a little bit. Kiara, there are the, maybe you guys are seeing the slides advance.
Can you see the next slide regarding tooth
No.
decay? No.
Nope, sorry.
That's the next slide we have, is the tooth decay effect.
Well, this is, sorry everybody, I kind of was counting on having that PowerPoint as my guide to the discussion. I'm going to pull it up on my computer so that rather than count on what obviously my computer is not acting right and not advancing. So if you could give me like 2 minutes to open it up, I apologize. Part of the reason why I wanted to make sure that we briefed all of the state chapters, one is that we have actually been in some of your states and visiting with some of your local school-based oral health programs, and we are hoping that as we move forward with developing the learning communities, that where we are in school districts where there is strong school-based oral health and strong school-based health centers, that if there isn't a connection already, we can help foster a stronger connection between the work that is going on in school-based oral health and in the school-based health centers. What we have certainly found in some places, there's a very strong connection, and Serena was actually at our visit when we were in LA Unified School District. In other places, we were surprised to hear that they were not very informed about what school has school-based health centers, and I hope in the future that we can use this as an opportunity to kind of build forward a stronger connection between the school-based health centers and the school-based oral health. This grant, in some ways, I think is a
expansion in terms of the work that the School-Based Health Alliance has done in the past, in that the work that we're currently doing is not specific to school-based health centers, but instead is very specific to the school districts. And there is not a strong unifying group that we have been able to identify nationally that has invested the time in bringing together people who are working in school-based oral health. So we think that the School-Based Health Alliance is the natural place to do this, has the certainly the history, sophistication, and ability to be that kind of backbone and connecting organization to bring people involved in school-based oral health together nationally, as well as to be able to create those stronger ties between the school-based health centers and school-based oral health. I think for whatever reason in our country, we have decided that certain parts of the head aren't part of health. When we talk about health, it often doesn't include vision, it doesn't include mental health, and it doesn't include dental or oral health. And there's a strong movement to kind of bring the mouth back to the body and to make sure that when people think about health, talk about health, or engaged in health activities, that thinking about oral health or dental health is part of what they take into consideration. So we are really excited that after we are nearing the completion of our first year of work, where we feel like we've laid a very strong foundation. We've made some really great connections. We have gotten a very strong connection to the school districts that we have visited, that we have been invited to submit our continuation grant with the DentaQuest Foundation, and this next few years will be the real launch of the learning community. And we are also really excited that this year's convention will have a specific oral health track, and we've worked really hard, those of us that have been engaged in the conversation around what the oral health track will look like. We're very pleased that it is going to include places that have done a great job of integrating school-based oral health and school-based health centers, as well as some places that really can highlight ways that schools have been engaged in promoting oral health as in both prevention and services within their school population. And we also know that this year, part of the benefit of having the convention in the DC area every year is that it allows state affiliates to make those really critical visits to the Hill and meet with their congressional members and talk about the importance of the work that they do and the importance of school-based health care. And we are this year making a plea that as you are planning your visits to the Hill and as you're considering who will be coming, that you might consider reaching out to those who do attend who are from your area and represent school-based oral health, either to participate in the Hill meetings with you or certainly to carry forward a message of the importance of thinking about health in a really holistic and big way. And again, the PowerPoint that you guys probably can see and I can't includes some of the reasons why school-based oral health is so important and some of the ways that your nurse practitioners in your school-based health centers are seeing kids with dental or untreated oral health problems, how it's impacting their attendance, how it's impacting their overall health. And we want to make sure that as we are talking about health for our students, we're making sure that we are including oral health as part of that. So let me just pause for a minute and see if there's any questions I can answer or information I haven't provided that would be useful?
Donna, this is Jessie, and I do have a question. It was at the very, very beginning when you started, and I couldn't hear it as clearly. Did you say that the basic purpose of this work is to try to embed oral health education into schools more, or is it also about embedding services in, connected to school-based health centers?
It's actually all 3 levels of health. One would be certainly health education, or making sure that when health education is being taught in schools, it includes something around oral health, and that oral health is part of overall health education in the school. It is prevention. Certainly there are many, many school systems that have engaged in doing screenings across a whole student body and identifying kids that may have unmet oral health needs. And you guys all know that there's been a big push for the interprofessional collaboration between dental providers and medical providers. There's been a push to see primary care providers provide oral health screens and fluoride varnish. So all of that is considered prevention. Many schools have school-wide, not school-wide, but targeted dental sealant programs where they're going into Title I schools. And when they come in, they do a screening. They usually do fluoride varnish, and then they provide sealants for those students who don't have active dental disease. And then there are places, certainly New York City, Los Angeles, Chicago, where you're seeing actual restorative services that are going on in schools. It's very offhandedly referred to as drill and fill. So it kind of moves all the way from providing the basic education around making sure that oral health is part of health education, and that would be at a school district level, to whether anyone is looking in kids' mouths and identifying if there's active disease or not, to ensuring that there's certainly I would love to see a stronger connection between the dental sealant programs that are coming into the Title I schools and where there are school-based health centers, that there be some connection and some knowledge or ability for those kids that get identified with active dental disease, some ability to for the school-based health centers to be engaged in helping with follow-up or case management. I think there's a lot of opportunity. So, long answer to your question, Jessie, it's all levels. And we, in our visits across all the school districts at this point, have found anywhere along that continuum. The school districts may, some have very little going on, but they are doing some basic early identification or education, all the way to some of our school districts where they have full operatories in the school.
Donna, if you have any sort of an executive summary or a shortened narrative version of the grants and some of the particular goals that you have, I would really appreciate if I would be able to see that, because we wrote a curriculum a number of years back in Connecticut for K-12 with age-appropriate lessons for oral health education to be used in classrooms. And we presented it to the State Department of Education, thinking that they would wholeheartedly endorse it and everybody would start using it, and found out that it doesn't really work like that. It has to come from within their own ranks of teachers. We're revisiting, and we have a committee revisiting that curriculum because some of the resources and things have changed since we wrote that in 2006 or 7, I believe. But we're having a very difficult time getting the State Department of Education to really take seriously this idea of incorporating oral health education into health education. So anything you have that might give us some fodder, to address that would be really very welcome.
Great. We do have a one-pager. It is based on our initial kind of foundation grant year and what our the 3 overall goals of the grant were at that time. We have put together our basic concepts for the work going forward, which is much more of a multi-year. I don't have a one-pager yet developed for that. We are actually right now in the process of building out from those initial concepts that have been approved by DentaQuest. So stay tuned. We'll have that as soon as we get that initial grant submitted. We'll be able to build off of that and come up with a more updated one-pager. In terms of curricula being oral health education curricula adopted by a school system, there are some school districts that have actually had oral health curricula that was presented to education and was adopted, and Chicago is one of the places that actually has a really great curricula. It was vetted by the Department of Education and has been approved for use. And so it's sometimes fun not to be at that national level and get that 50,000-foot view across many school systems and see who's got what going on, and then kind of feel frustrated because so many people are knowing that they have the same needs and the same gaps, and they're developing very similar tools and resources to what already exists. So I'm happy to point you towards some of the places that we've identified that have vetted their oral health curricula already through education. The other one I would point to is LA Trust. So LA Unified School District has a nonprofit arm, which is LA Trust, and LA Trust has a oral health curricula that has been adopted and approved by the school board, and that is a tool that's available online. And I'm talking off the top of my head, and I may be wrong, but I think the other place is Las Vegas, which has also developed a curricula that was done in conjunction with education in the Clark County School District and was unanimously adopted and adapted to their health education curricula. So there's 3 places that have done it, and I'm happy offline, Jesse, to put you in touch with the people that really work to make that happen, and I'm sure they would love to be able to help you with that.
Oh, that's great. Thank you so much.
Okay, we're cutting into the committee time, so I'm going to ask that we will end the School-Based Health Alliance updates here. Serena, is that all right with you?
Yeah, I think that's what we need to do. Yeah, we'll have to just defer it to either the policy call. I was thinking maybe Suzanne could talk about the place of service call. I don't know, service code. I don't know when the next policy call is scheduled, or we just have to defer it to the next state call.
We'll follow up through a written communication.
Okay.
I apologize. If anyone has any questions, please feel free to email me.
Okay, great. Thank you, Donna. Does everybody have the call-in numbers? I am not sure that I do. So, okay, there we go.
Serena,
okay.
I was just going to ask the same thing. This is Sarah.
Yep, okay, so they're on the screen. So they're on the screen, but when we disconnect, they might go away. So everybody write theirs down.
Wait. Serena, this is Holly from Washington, and I joined late, and I'm actually not on the computer. Can you give me the number for the standards and measures?
Yes, 712-775